Hi, I'm Dr. Armand Sarkisian. The world is going through a unique and difficult time. The quarantine and the stay-home order is in full effect and has forced millions of people to shelter in place. Most dentists have closed their offices and are seeing only emergency patients. Dental emergencies happen regardless, and yet many patients don't feel comfortable leaving their home to go see a dentist at this time. In this video, I'm going to discuss some of the most common dental emergencies and discuss over-the-counter products which can help with temporary solutions. I will provide general tips, but please make sure to follow the product's directions for use. If there's tooth pain, there are several products available that can be applied to the tooth to relieve pain. Some of these products should be just applied to the tooth and made sure not to go over the gums. Otherwise, they'll cause gum irritation. Some other are made for tooth and gum pain and can be applied to both. If you decide to use these medications, I suggest applying a small amount of the gel or liquid on a cotton pellet, squeezing the cotton between your fingers to get rid of the excess medication, and then applying the cotton to the tooth for the amount of time suggested by the manufacturer, or a minimum of 1 minute. If after several applications of the medication the pain does not go away, then you may need to go see a dentist. If you have a filling that fell out or a tooth that broke, there are several special paste-like products that can be temporarily placed in the lost filling cavity or to cover the broken part so food particles do not get packed in the hole. They also help with sensitivity. To use them, first rinse and clean the tooth with warm water because cold water will trigger pain. Take a piece of the paste and roll it between your fingers to make a small ball. Place it in the cavity on your tooth and overfill. Now make sure to bite and grind to adjust the material size to your bite. Remove the excess with a piece of cotton. Make sure it's adjusted properly to your bite. If the temporary filling is higher than your other teeth, it can cause issues like tooth pain or even tooth fracture. These pastes get hard by saliva moisture in about 2-3 hours, so avoid chewing on that side for that amount of time. The same kit that was used for the lost filling can be used here. First, try to get out as much as the old cement as possible from inside the crown. Then try the crown on the tooth and make sure you can place the crown back at its original position. If you cannot, do not try cementing it. Also, if the crown has come off with the post or a piece of the tooth is broken and stuck in the crown, I don't suggest placing it back because it will really be hard to place them in their correct position. First, brush and rinse your tooth with warm water and leave it moist. Dry the crown and place a small portion of the paste inside the crown and place it on the tooth and press it into the original position firmly. Bite and make sure the crown is seated all the way. The tip here is to use a small portion of the paste so it does not interfere with the crown sitting and making sure it's seated all the way. If you place the crown on the tooth and you press and bite and it's not sitting all the way, reason maybe it's either not seated in the right direction or there's too much paste placed inside the crown. In this case, take the crown out quickly before the paste sets hard. Remove the paste from inside the crown and try the steps again. This paste will get hard in a couple of hours. And if the tooth stays higher than the other teeth, it may cause problems like pain and tooth or crown fracture. Clean the excess paste and don't eat on that side for about 2 hours. If a denture is loose, you can get denture fixing products that can keep the denture in place. These products come in the form of gel, powder, or tapes. Also, if the denture is pushing on the gums and it hurts, you can use the oral pain relieving products that we discussed earlier. There are also over-the-counter denture cleaning tabs available. These tabs clean and lower the bacteria count on the denture and can lower inflammation. If a denture tooth has come off or a piece of the denture is broken, there are special denture repair kits available to glue the parts together. Just make sure the parts are glued precisely at the original location. Otherwise, the denture may not fit or function properly. Canker sore is the most common oral ulcer. They happen for several reasons, but I have seen them happen mostly when one is stressed and the immune system is down. These ulcers can be very painful. They heal by themselves in a couple of weeks, even with no treatment. And the treatment is mostly to relieve the pain until they heal. There are several products in the form of mouthwash and liquid or gel that can be applied to the lesion to relieve the pain. We discussed them in the tooth pain section. As mentioned before, there are some stronger products that are for teeth only. Make sure you use the products that are suggested for gum pain. Stress can cause one to start grinding or clenching their teeth. This can cause pain in even healthy teeth that had no problems before. If you notice you have started having pain in one or several teeth for no reason, trying a night guard may be a good idea. There are several over-the-counter night guards available that one can get and prepare at home. I see many patients in my office with healthy teeth and gums and tooth pain. Most of the time, just getting a night guard helps them a lot. Please know that these are mostly temporary solutions, and you need to see a dentist to get permanent treatments for the issues discussed whenever the time is right. I hope this video can help in some way. I'm sure we'll get over this fight very soon. For the meantime, stay safe and healthy. Thanks for watching.